March is Lymphedema Awareness Month. Now, what is lymphedema? Well, that's a common question, and why you should watch this video. Now, lymphedema is a swelling-based condition that can affect anywhere in the body. That's right, anywhere. Head, neck, abdomen, face, arms, legs, you name it. Now, before we talk about why the swelling happens, we need to talk about what is your lymphatic system. Well, what this is that it's a series of vessels that work alongside your veins to return fluid back to your heart. Now, the difference between the veins and the lymphatic system is what they allow to be inside of the vessel itself. The veins only are going to allow small, cleaner molecules, whereas the lymphatic system is going to pick up pretty much anything else, which means that the fluid in the lymphatic system needs to be cleaned before it returns back to the heart, and this is done in the lymph nodes. So the easiest way to think about this is a toll booth. Each lane of traffic has to go through the toll booth, just like all the fluid in the lymphatic vessels have to filter through lymph nodes before returning back to the heart so that it can be recirculated throughout the body. Now, what happens if we have a removal of the lymph nodes, or decreased toll booths in the example we're using, or just a malformation of the lymphatic system? Well, that results in excess load that the lymphatic system cannot handle, which then creates a backup of fluid. In this scenario, we can see the traffic is representing the backup of fluid. So what it does in the body is it looks like swelling. Again, this can happen all throughout the body: arms, legs, face, genitals, abdomen, anywhere. Now you may be thinking, why is swelling such a big deal? Normally I just put ice on it and it goes away. But that's a different kind of swelling than this kind of swelling. This is actually a chronic condition that is currently non-curable but can be managed with physical therapy and some surgical procedures. If the condition goes untreated, it can progressively get worse and the limb can get larger and larger, and it puts the skin at increased risk of infection. Now that you know more about lymphedema, we can talk about what to do about it. Well, there's two phases of treatment. The first phase is to get the involved area smaller, and we do this via a combination of techniques that includes manual lymph drainage, compression bandaging, skin care, as well as exercise. We then move to the maintenance phase, which is where we keep the involved area smaller. We do this via a combination of compression garments, as well as potential use of compression pumps, exercise, and proper skin care. Now that you know more, share this video with others so that the awareness of lymphedema can grow.